ba bangwe o thola motho ke mosadi mara a so ka itebella yena self da. And gore o bone gore batho ba itebelle o tla utlwa motho a re tsenya tampon a re bjanong ko go ta bjang, then you know a di tsamaye pila biology ya leka mo goneng the pipe e tsamaisang the sperm is the same pipe e tsamaisang le
moroto. Yes.
But mo mosading it's different. There are two openings who get cervical cancer. Have infection with a virus called HPV. Human papilloma virus. It's a virus. Like, you know, HIV is a virus.
Yes.
Corona.
Is it caused by a big 4-5? Like maybe someone with a big 4-5? What?
Kill me again.
No. Hola, welcome to the Social with the Prince. It is another year, 2023, exciting things. I think we're also making sure that we're up in the scale because there's a lot of information that we need to share with our people, the audience, everyone from home, and anyone who's on the social platform. There's something which is very interesting that has been happening that I feel now we need to cater for our ladies out there. So on our socials, I figured that on the analytics, it shows that there's more females that are actually watching the episode. So what I would like to do is to make sure that we can just link and give information. We have someone special today, and I would like to introduce to you guys without wasting any time, Dr. Ausi Nkhe. Because on social media, I see Ausi Nkhe. But she'll just give me a bit of a background. I'm a bit nervous, I must say. Because we just recently met and about the information that she has. Welcome to the show.
Thank you so much, Dapre.
Dapre.
Yes, I'm really honored to be on this podcast. Thank you for reaching out. I am excitement as I am.
So here's the thing. There's when I go to a doctor, it's either I'm sick or I'm nervous. But ever since we got here, we were talking and I was like, oh, she's so cool. She's so interesting, you know? Do we say Ausi Nkhe? Am I pronouncing right? And also, can I say Dr. Nkhe? Which one are you normally known as?
Okay. Nkhe you are right. That's the right pronunciation.
Because I'm Tsonga, and you know, Tsonga people, they will just, you know, not be sure of what they can pronounce it. Yeah.
It is right. It is Nkhe. It's a Southern Sotho surname. I am a doctor, so we have established that. So we can do away with that. Most people call me Ausi Nkhe. And they tend to call both name and surname because, you know, Ausi is like Sisi. So they feel like if they say Ausi, it's disrespectful. So they just call the whole Ausi Nkhe. And I'm happy with that. And if you feel the mood or the vibe, you can always call me Auntie Ausi.
Auntie Ausi?
Yes.
Yeah, that's amazing. You know, there's people that can actually say Ausi, saying that it's your name. What's your name? What's
my name is Ausi.
It's Ausi.
It's my surname is
for real.
Exactly.
Your name is Ausi.
Yes.
Nice to meet you, Ausi.
Oh, thank you very much. Thank you, Dapri.
So how's your day? How's your morning? How's it been?
It's been good. Very relaxed. I'm on holiday right now. So I'll only be opening on Monday. So my morning was my usual yoga, a bit of, you know, just spending time with myself before the hecticness of the year starts.
Before us, you know?
Before everything happens. But it's been a wonderful morning. Thank you for asking. And
now, when we arrived, you're so chilled, right? And I'm asking myself, I'm like, normally doctors, you know, there's some certain order, but you made us feel very comfortable, you know? And I would like to thank you for that, though. But like, what makes you to be like that?
Ish, I don't know, the Prince. Maybe it's just my nature. But overall, I don't take myself so serious. I know people have a kind of like a sense of what they think is the typical doctor. But I'm not a doctor first. I am Auntie Wabatu first. I'm someone's wife. I'm someone's mom. I'm someone's sister. So, but Doctor Habatlala it's what I do, but it's not really who I am. I am a person first and foremost, and being a doctor is my calling, is the work that I do, but it doesn't supersede everything. Yeah. So, I've been a doctor for a very long time, so there's nothing new there. I mean, we're counting for 25 years.
25 years?
So I'm used to it.
25 years as a GP?
Yeah.
Wow.
Yeah.
So I want to know, because we were trying to also approach gynecologists, but what's the difference between GP and gynecologist? And where did it all start? Like, take me back, like, high school or...
Yeah, okay. I was born in Soweto. So I started off my primary school in a local school called Edumezweni.
Edumezweni.
Yes.
Yeah.
And then we moved to Tembisa with my parents.
Yeah.
And I went to Etaleni. It's somewhere in Kalambazo. People from Tembisa will know. And then I moved to Shugmani, which is also in Tembisa.
Yeah.
And then at some point, I also stayed with an aunt of mine in the Free State when there were riots in Tembisa. It was a bit unstable. I've stayed in the Free State, went to a school called Mbonisweni. And then the last bit of high school, standard 8 to 10, I was in Mpumalanga in a very normal school, nothing fancy, called Evezubuhle High School.
Evezubuhle High School?
Yes, it is in Evezubuhle. The area is called Evezubuhle. So I went to Evezubuhle High School and matriculated there. And I mean, if you ask me what started the doctor journey, when I was younger, I think in my primary school years, you get asked, and I used to say teacher.
Yeah.
But then after a couple of years when I was in high school, but then, there's also outside influences.
True.
People will be like, you are so good at maths. You could be a doctor. But by then, I also had it, that I would like to help people. And I had such an interest in biology. Like, I like knowing how things work. And I like solving problems, So for me, medicine really taps into that part, that side of me of solving things. Because with medicine, you have to find what the problem is. So it's like detective work. I think in another life, I could have been a detective. I love crime shows, by the way.
Yeah.
Because it's about, finding out what's going on, solving the problem. So I then, said, okay, I would like to do medicine. And particularly staying in the rural area. I mean, there was one doctor for a whole big stretch.
Yeah.
In the village. And I used to have this thing that, you know what, I would like to be a doctor and come and help the people in this village,
Yeah.
So that propelled me. But I also had a lot of support from my teachers that, you can do it, and that is very important.
So you were the smart kid in school?
Yeah.
I know it, yeah. Smart kids, you have to be either a pilot or a doctor, yeah.
Yes. So I then did medicine.
Where did you study medicine? Which
at the University of Cape Town.
Wow. Yeah. You moved quite a lot, eh?
Yes.
You went to different schools. Yeah. It's almost like grade 1, you go to the school. Grade 2, you go to the school. So, but tell me something. With all that moving, what was the experience? Have you felt like you could have stayed at one particular school? Or you also, for some reason, kind of learned that this is how life is? And you picked up something from it, though?
Well, I think when it was happening, you are not thinking much about it.
Because you're still young.
You are still young. Your parents, well, in my case, my mother, is making the decisions, looking at what's best for us. I mean, we were in Tembisa and things were not always stable. So, my mom always had to look at what's best for us. She was a very big advocate of education.
Oh, yeah.
So her decisions, and I know them to this day, they were based on where will my children get the best education that she could afford. So that's how we moved. But the moving really opened up my mind. By the way, I love traveling too.
I can tell because
I love it.
yeah.
But the moving really expanded my horizon in terms of living with different people, understanding different people. I am a people's person.
Yeah.
I want to know what drives people. Why do people behave the way they do? But that gave me a very nice platform. I mean, when I was in Mpumalanga, we lived with a granny who had grandchildren and even great-grandchildren there.
Yeah.
We were about 21 at some point.
21 in that household?
Yeah.
21?
Yes.
How old were you then?
I was about 15, 16, and it was all age groups. So how tall were they?
Yeah.
They are on top of the table, they are under the table.
Yes.
It's a papa.
Yeah.
Yeah. We had a big black pot.
Oh, yeah.
And then the bigger girls, so they would have this one, and they would be going, you know. That kind of experience, I needed that. I believe I needed that because it showed me something about human nature. I can tell you, even today, I post now and again about money, that money is not everything.
Yeah.
You know, that time you would have thought, someone from outside would have said, oh, these are impoverished surroundings. But the love that was in that house, you know, like I needed to experience that. I mean, and then you know manganyisa.
What's manganyisa?
Manganyisa is pieces of meat in kiddie shave offs, that excess meat and fat. Yo, how na le manganyisa base keeper because yo Gogo could cook ne.
Yeah.
And then we're saying we would have bo baraking macheu. Gogo would make macheu.
Yeah.
But then you see that it's not about money.
It's all about just, you know, where you
that Gogo had in the evening. We are sitting around the fire. Gogo arabutsa di tori tsa di buku. I mean, I will never trade that for anything. I'm so grateful for that experience because I think I'm all the better for it because I went through that.
That's what you went through.
Yeah.
So you went to UCT?
Yes.
And how was UCT? And what were you studying there? Medicine?
Medicine.
Yeah.
UCT, it was different times then. In my class, there weren't many black people at UCT.
So you were the first black?
Medicine. No, not the first. But we were, I think, the third or fourth, might have been the third group of a sizable number of black people coming into medicine. So you would find that in a class of about 280 people, there would be 30 black people. So, yeah, it was rubbish. You know,
you must have been very smart, though. Because it's not easy back then, I believe. Yeah.
Yeah. Well, okay, I admit, I am smart, guys. I think we must just get this out of the way. So, it was also a very trying experience because you are a minority. And I don't come from St. Mary's, St. Mangma. So, you know, you want to let that thing, even from the beginning, first year, people are asking, so where did you matriculate? Oh, I was at St. Mary's DSG. No, I was at St. Stephen. By the way, now, yo, you know, like, like, where is that? So, you know, there is that. Yeah. But then, for me, the nice thing about academics, they level you out. You know, in the first year, I could feel seriously disadvantaged. But by the second year, it was really about Dinsangamo. It was not long about where you come from.
Oh, no.
We are starting on the same line. Yeah, sure. So I enjoyed my stay at UCT. Yes, there were those things where you could feel the racial discrimination.
Yeah.
But, you know, I don't know. I was not very focused on that. busy soccer. I was a soccer player.
You're a soccer player.
I played all the way to the national, the South African student team.
You lie.
Number one goalkeeper. Like,
Yeah.
so I had absolute fun. I was studying, but the books didn't overtake everything. I was studying. I knew what I was there to do.
Yeah.
Don't get me wrong, because in my family, I'm the first doctor. So you understand that you cannot fail the family. It's like everyone's hopes are with you. But I did find a way to stay sane, to stay calm, and that was through soccer playing. And it really did a lot for me, because ukasidlala ibhola competitively unwemabyala ufrike, like 3 times a week I'm on the soccer field training. On Sunday I'm playing.
You don't have time.
Or whatever.
Yeah.
So it was very good that I had that.
You had a routine, because it was like an objective or a goal that you must reach.
Yes.
Yeah. Yeah. Are you like an overthinker? Because I know that people who like planning. Yeah.
I have been.
You have?
For most of my life. But there's a point where, I confronted it with the help of a very wonderful supervisor of mine. I was studying at UNISA for my master's in business leadership, and I met the wonderful late Professor Ferreira, professor of strategy. He was my supervisor for my research.
Yeah.
And no, he got me right. He spoke to me very kindly and gently about, what overthinking does. Because it goes with also perfectionism. So
you're a perfectionist also?
Yes, I'm a work in progress. I'm better than I've been before.
How did you cope with mental, knowing that you're an overthinker? What were your getaway tools, or what's that?
Coping mechanism.
Coping mechanism. Yeah, coping mechanism. Yeah.
I think that the first strategy, or the first point is reflecting. If you're a person who reflects and looks at yourself, I do a lot of reflection.
True.
So you have to accept the problem before you can solve it or attempt to solve it. I mean, it's like when you're an alcoholic.
Yeah.
If you can't stand up and say, guys, hi, my name is Aus, I'm an alcoholic.
Yeah.
We are far from over. Even with drug addicts. Yeah. I mean, we do the same. If you want to get help, you have to acknowledge first that this is what I am. So for me, with overthinking and being, this perfectionism, it started with me identifying that is what I am. And, being shown, like with the late Professor Ferreira, being shown that if you continue on this road, you will never finish your degree. You will never finish that. You are going to lose business opportunities, because when you are still working, ibe sharp 11 o'clock you attend.
Yeah.
So, that helped me to be aware of it. Okay. So I can't say I have 100% gone over it. I'm a work in progress. There are times when I catch myself, I'm like, no, this must go now.
It's too much. I'm experiencing that. I'm like an overthinker. I need to shoot. I need to plan. I need to meet with a team. What's the next content? So I'm trying to figure out, how do I get out of that whole space? Yeah. But awareness is the key.
Yeah.
So gynecologist. Yeah. How has it been for you to work as a GP? Because I know that on your content, I saw you speak also about, what is it? Cervical cancer. Yeah. What is that?
Okay. Okay. I must clear this up first before we move, ne?
Yeah.
Because people will start thinking maybe I'm a gynecologist.
Oh, yes.
I am not a gynecologist.
Oh, yeah.
I'm a general practitioner.
General practitioner?
Yes.
Yeah.
GP. Master of... What is that phrase? Jack of all trades, master of none.
Yes.
Okay, now I'm a jack of all trades and master of some. So,
yeah.
A general practitioner, I think that the best way to differentiate between the two is to take it back to our training. So when you go to medical school to train to be a doctor, at the end of your training, you come out as a general practitioner. because you are taught the basics, like you cover everything that a doctor needs to know, from the women's health, the men's health, the mental health, everything is covered. So a general practitioner is an all-rounder, everything. You can, tap into all the fields.
Yeah.
However, a gynecologist is a specialist. So from a general practitioner, you have to start there. You can't be a gynecologist and you are not a general practitioner.
Oh, so you
We
must.
all start there. And then you decide that, okay, now I want to specialize and only focus on children. Then you can go for an additional 4 years.
4 years.
Yes. After you've done your initial general practitioner, which ranges from 5 to 7 years, depending on which university you go to.
Yeah.
So once you've done your general practitioner, if you decide you want to focus on children, you go and train to be a pediatrician, Dr. Wabana. If you decide, no, not give a deal only with women and women's issues, then you go and specialize for an additional 4 years to just focus on the women's issues. Then you come out as an obstetrician and gynecologist. Like an obstetrician, about dealing with pregnant women, and then gynecology, all women, whether they are pregnant or not. So when you go for that 4 years, you come out being able to deal with all women. You are an obstetrician and you are a gynecologist. That's why they are called ONG specialists, obstetric and gynecology specialists. If you want to do neurology, you say, no, I want to just focus on the head. You can go for an extra 4 years and then you come out as a neurologist. So it's additional training on top of the GP training.
Yeah.
So now I've done the GP training. I didn't want to specialize because now personally, variety. I enjoy that, everybody, so that is what I like. And a general practitioner also allows you, or for me, it allows me to go beyond just the patient one-on-one. So it allows me to do other things like get involved in communities, because the general practitioner is the one who's closest to the community. So it allows me to interact more with the community.
So that's why when they say general practitioner, we're coming to a general practitioner.
Yeah. And if utlako general practitioner, and I see a problem a higher grade, maybe then I will then say, okay, this is what I see, but my capabilities develop. So I then refer to the gynecologist.
There's a misconception, people saying that GPs can actually do everything, meaning that you'll get assistance and obeshapo, but when you find that a patient really needs a specialist, people have about doctor. Have you ever encountered that have feet or one or no, you actually need to be transferred and stuff like that?
Yeah, I get sometimes people don't understand the differences. So bonabano doctor, they think doctor knows everything. But remember, like right now, I'm working in a surgery. So if you need brain surgery, how is Dr. Nkri gonna do brain surgery? So I have to refer you to the neurologist or the neurosurgeon, who is going to do that operation. But it is important, and I think this point I must make, Prince. It is important that people, mama omhambayo, baba omhambayo, like have your GP.
Yes.
The beauty about it, Prince, when you have a GP, it makes it easier for your health issues to be attended timeously and properly. Because if it's a good one, I'll make an example of someone who's been my patient for years, and I saw him during the COVID, the lockdown. He came in before Adula Fatsi. I already knew who we are speculating today. Like he was. You see, this is a guy I've been seeing every 3 or so months for years. So I know how he walks. I know how he breathes. I know his color. But on that day, I looked at him and I was like, okay, you don't want to make someone panic. I was like, okay, do la fats. And then I was like, I'll be with you now. Came out, made the call, called the ambulance. But that's what you need. And sometimes people make the mistake. Sometimes you might have a problem. utle ko doctor, and then I do something. I'm making an example, ka TB, wa hotol, but we don't know TB yet. So doctor gives you an antibiotic. You don't get better. What do most people do? Batswa, baya ko Dr. Mahlangu. Dr. Mahlangu has to start afresh out of antibiotic. Be better. We are good Dr. Sikukuni. But you see, had you stuck to your doctor?
Yes.
When you don't get well on the antibiotic, I know, okay, now I must step it up. Or now I must go to the next level. I must start doing investigation. But hands on go everywhere. Then you are just delaying your
actual cause. We're not finding out. Yeah.
Treatment. And that doesn't mean people shouldn't go to any other doctor.
Oh, yes.
You can go to another doctor. You know, sometimes it happens that you've been coming to Dr. Nkri and hey, I want it progress.
It does happen. You've heard people like, I'll go to the other doctor.
You don't have, we have a term for it. It's a second opinion.
Yeah.
You know, then sometimes Prince comes to me and says, hey, doc, can I pay any more? I say, go to that specialist. Comes back, comes back, Prince says, hey, I'm not okay. Still, no, go back, maybe we'll try ramp it up a bit. How if Prince comes to me and say, hey, but doc, let's say, cancer, and I happy, I don't believe it. No problem, Prince. We leave that specialist, we know what he thinks, we take you to a different specialist. What is that called? A second opinion. There is nothing wrong with getting a second opinion.
True.
If Dr. Mahlangu and Dr. Mapena come back together, Bali to Barakin to in now your GP, can present we are born now. So now we must just get on and get to the treatment plan.
Yeah.
So that is what the GP does.
Okay.
You need to have a GP.
You need to have a...
neurologist. But then how to back to send? So nephrologist.
And they sometimes want report from your GP.
From your GP. Because the understanding is that the GP is the coordinator of care. You see, everything. So I have your history here. So
medical history.
Your medical history. That is the role of a GP.
We have tools there on the table. We'll get to them. But I want to know, because I saw something that you've posted also on socials. I follow you now.
Oh, thank you.
So I want to know cervical cancer.
Yes.
What is that? What are we talking about?
All right. For the sake of the listeners, I think I must go back to biology just 1 second, because I got a cervical cancer. Yeah. So the cervical, it's a body part, it's a cervix.
Okay.
So it's a cancer of the cervix. Now we need to talk about what is the cervix.
Oh, yeah.
Yeah, because why is it? Baba ngotola motho ke mosadi mara so ka itebella yena self da.
Yeah.
And ho bona go batho ba itebella o tla utlwa motho a re tsenya tampon a re byanong go go ta byang. Then you know. Adi tsamai pila biology ya leka.
Yeah.
Morning. The pipe it's amazing the sperm. It's the same pipe as amazing
lemorot. Yes.
But what was adding it's different. There are two openings. One opening yamoroto and then one opening the sexual pleasure and the delivery of baby.
That's what we like. Yeah.
I know.
I don't put it. Yeah.
So let's start with the basics first. What is a cervix? People know about pupelo. I get pupelo kimo if you are pregnant mwana o tlo gola ka mo hara pupelo.
Yeah.
But at the bottom of the pupelo hona le monyako. That door that's gonna open. Ailina go mwana abe delivered. We call that place the mouth of the womb. And in medical terms, it is the cervix. So the mouth of the womb is the area that we are going to be discussing when it comes to cancer of the cervix. Now, maybe let me get to the cancer part.
Yes.
What is cancer? Because I get a cancer of the cervix.
Yes.
So what is cancer? Cancer is the abnormal growth of cells in that part of the body. We know that sometimes cells can grow abnormally in different parts of the body. Sometimes you can get a sudden abnormal growth of cells in the breast, then you will get a lump. And if that lump indeed gives cancer, because some lumps are not cancer. There are some lumps that are there, but they don't cause any problem. But the lumps that are cancerous, that are cancers, are problematic because the cancer can spread and go to other parts of the body and cause problems in other parts. But if it's just a growth and it's sitting there, it's not a cancer, then we don't have a problem. We can remove it and we are done. Or sometimes we leave it depending on what the person wants. But cancer can happen in different parts of the body where there is this abnormal growth that is uncontrolled. Now, when it happens at the mouth of the womb, that's when we term it cervical cancer.
Oh, because of the cervix.
Because of the area where it happens. If it happens in the breast, we are going to say breast cancer. Yeah. If it happens in the lymph node, I
saw someone, he had this thing, and I felt something, Linda. Maybe I need to check with you. But it was something like a gunganyana, like a big...
Yes, it might not be cancer. I must not create utata.
Maybe Shapana.
Yes. Yeah. So the cancers can happen in different parts of the body, but when it happens there, that's when we call it cancer.
But abnormal cells. Is it possible to get cancer because of a injection or because of you got it from your diet or...
Very nice question. You see, now we are talking about what causes cancer.
Yes.
It is not always straightforward that you can say your cancer was caused by this, your cancer was caused by this. But there are some general factors that we associate with cancer. And I want to focus on cancer of the cervix because for different parts of the body, there could be different factors, Yes. So if you look at cancer of the cervix, it could be family, genetic.
Oh, genetic.
Yes. And even with other cancers, you find in families that cancer, the breast.
I've seen
cancer. So there are genetic factors that can contribute. But there's also environmental factors that can contribute to cancer. And for cancer of the cervix in particular, there is a certain drug that was used some years back that used to contribute, but now we don't really use it anymore. It was used to stop miscarriages and stuff. It's no longer used. But I'm just saying, or it can be environmental factors. Smoking is also a contributing factor. It doesn't mean that everyone who smokes will get it, but it can be a contributing factor.
The body.
Now, here's the thing with cervical cancer. You see, I think this is why I'm this passionate about cervical cancer. It's one of the few cancers where, for most of the people who get it, we know exactly what caused it. Most cancers, we don't know. Or it could be that, maybe that. But for cervical cancer, more than 90% of people who get cervical cancer have infection with a virus called HPV.
HPV?
Human papilloma virus.
Yeah.
It's a virus. Like, HIV is a virus.
Yes.
Corona.
Is it caused by a big 4-5? Like maybe someone with a big 4-5? What?
Kill me again.
No. Yeah. So what is it?
HPV. Okay. Yeah. This HPV, there are different types of HPVs.
Oh, yeah.
Another time we can go into detail. But there are certain types that are associated with cervical cancer. Now, you're asking a very good question. Here's why.
Yes.
Well, it's a sexually transmitted infection.
4-5.
Sexual transmitted through sex.
Yes.
The size of the penis is not a fact. But, it is through sexual transmission. If you have intercourse with me, and I have HPV, and we are having unprotected sex, it is very possible that I can pass it on to you. And HPV is a very common STI. It is, the stats there, up to 80% of people who are sexually active, who have been sexually active, have had HPV at some point in their lifetime. I kid you not. Yeah. It's very common. It's very common. But then, not everyone who gets the HPV will end up with cancer. Let me talk about, that's why I started by saying there are different types of HPV. Yes. There are certain HPV types that cause what? You know what's cauliflower? On 4-5, you want to cauliflower, or on the sometimes about on the anal area, or on the penis, or on the vagina. How we share cauliflower. That is caused by HPV. Yes. It's sexually transmitted infection.
And I never like cauliflower.
And it's so healthy.
And but it's so strange because cauliflower is healthy, but when you have it on your body, it's not healthy.
Yes, it doesn't belong there. Yeah. So there is those types that cause the cauliflower. But then there are other types, and I want to call them out by name because people need to know the stuff. We don't need to hide stuff. It's type 16 and type 18. Those ones are the ones that can cause cancer of the penis, cancer of the vagina, the vulva.
There's cancer of the penis. I actually thought it's only just females who have,
penis, vagina, cervix, anus.
Oh, no.
Yes. Bone. No part is exempt. And then this HPV causing the cancer, it can also cause cancer of the head and neck and of the mouth and throat.
Oh.
Yes.
Is it because of foreplay?
Thank you, Prince. Wait, so I don't have the questions out.
Good,
You see, now we are getting into something. How do you prevent yourself? Because now we know it's a sexually transmitted infection. Obviously, if you are going to be having oral sex and mutwahao onali HPV, there is a risk that you will end up with the HPV.
Yeah.
On your throat.
A cauliflower.
In your mouth.
It's not a cauliflower. It's something else, but it's not a...
Well, you could have some what there, but the one that I'm talking about now is the cancer one. You can get infection with those HPV types. So, what is the moral of the story? On a Friday? No. If you're going to be having oral sex, play safe, my guy.
Don't go down, Hey.
For real.
No more ice cream,
Let's talk to people who go down.
Plus me, I'm very tall, so going down will take me I'll have time to think about going down. I'm like, I
don't know, Prince, So, but let's talk about the precaution. But whenever I talk about them, people don't know them. And I'm starting to think, people are not playing safe too.
Yeah.
Only a sheath that you can use when during oral sex. And it even comes in different flavors. If I sell you, then it means maybe I was a stalker because
like something almost like a condom, but you can just...
but it's like a square sheet that you can put on the vagina. And but for the penis, the condom is there. And I get it in flavors. It's for those. I suppose that could be a good plan.
But sheet, no sheet, I'm not going down.
Okay. So that is the HPV that we are talking about. Sexually transmitted, and it can cause the cauliflowers and the cancers.
I want to know, you have some tools with us, but you'll feel free to let us know what we're doing. What were you talking about? Cervical cancer.
Yes. And we were on the causes.
Yeah.
So we spoke about the fact that it's a viral infection, sexually transmitted.
4-5 and vagina.
Yes.
Yeah. Okay.
Yes. So.
Doesn't matter if it's big, like.
No.
Because like if it's big, and then you shut up in a big way.
No. It matters if it's circumcised or not, by the way.
Really?
Yeah.
Okay.
Okay. Let me talk a bit about prevention. Maybe that's what we need to talk about. Because then you'll see what the 4-5 can either.
Yeah.
So now we know that the biggest cause is this HPV infection that is sexually transmitted. So when you talk prevention, obviously we must start there. So if you don't want to get HPV, which can lead to cancers, what do you do first? You start by preventing the sexually transmitted infection. How do you prevent sexually transmitted infection? I don't think anyone hasn't heard about this because we've been dealing with HIV for how many years? And we've been talking about prevention of HIV for too long. But just as a reminder, let's talk about how do we prevent sexually transmitted infections, of which HPV is one of them. You've heard about the ABC, ne? So maybe let me start there. A way of prevention. Abstain, be faithful, condomize.
Be faithful.
Hey, I just make abstain. Why would Jambila be faithful?
Okay.
So abstain, not cloth. I mean, that's the first way you can prevent.
Which is not happening.
So yeah, but we know that it doesn't fit everybody. But then I want to talk to younger people to say, because when we talk to younger people, I do also talks in schools. I talk about circumcision and all kinds of health promotion.
Yeah.
And one message we need to make sure reaches the younger people is that when we say abstain, we are not saying abstain for the rest of your life. Because they start to think, no.
Yeah.
We are saying delay having sex. Don't start too early. Because when you start too early, you can't negotiate safer sex. Also, if I'm a 25-year-old guy and a kijola only 15, minus the fact that it's legal, by the way.
Yeah.
But it's happening, we know.
Yeah.
Only 15. Only 15, how is she going to advocate for herself and say, no condom, no sex? But it's someone that you.
Yeah.
When a prince no condom.
Yeah.
Get all the Riot Act all the way to the bottom. Because I can speak and advocate for myself. But the younger you are, the less able you are to advocate for yourself. Even for boys. The young boys, mutunali 15, and then Oriena, Ujolali Ausonangli 25. How are you going to negotiate safer sex when now 15 Ujolali Ausonangli 25? So you see, it was about intergenerational sex.
I see.
It's one generation and all in older. So
intergenerational sex is sugar mama.
Sugar daddy.
Sugar daddy.
Wabona mo hauna power. Ya hore o te polelle strongly to say no, I'm not gonna have sex with you. So we start there by saying abstain. But if you're not going to abstain, for the younger people, just delay until you can talk for yourself.
Yeah.
Then the second one is your favorite one. Be faithful.
Mommy Lord.
Yeah.
Be faithful.
Come on. Hey.
There's a thing called Jolo. What do they say? Jolo Wanyisa. Started in Mamilori.
Oh, sure.
You should see people on social. People are crying.
Oh my.
So maybe 2023 things will be better. But yeah, we are on be faithful.
So Arzaming be faithful.
Yeah.
I'm not from Mamilodi.
Yes.
I'm from Mambisa Ikas.
Yeah.
But hey, happy Mamilodi could like Uncle Joe. Uncle Joe, faithfully, Papa. Ya doctor. Umadlamini Mamilodi and then Umama Bena Ugandeve. Yiriprajo Axio. Be faithful to one person.
Hey guys, did you hear that?
For Yana, that's being faithful. That's not the be faithful we are talking about.
And it's not that. It's not. Yeah.
One person. Because, you saw Moscow intersection. I don't know if I can talk about intersection.
Yes.
Ujola nalo, lo, jola nalo. It's a whole web. Yeah. So, be faithful.
Yeah.
And then condomize. The correct and proper use of condoms.
Okay.
And I can't imagine that's already related because we already like guy. Who don't hey, give it 4 round. Mara not so condom one. So like we need to advocate for the correct and proper use of condoms. 1 condom per round.
1 condom per round.
Hey, what's like is 1 condom the round to say 4? No, 1 condom. 1 round.
But you find apparently women banyakakanam.
What about because not only are you opening yourself up to HIV, you open yourself to HPV and all other sexual transmitted infection. And then you find now we have big problems. The discharge, so on the private parts. So it's not just HIV that you're worried about. It's not just HPV. There are a whole range of other sexually transmitted infections, which when we have time, we can just delve into.
So what's this thing, Barry? Like it smells like fish. What is that? What?
There's a sexually transmitted infection that for a discharge that has a very strong fishy smell.
It's not tin fish. It's not like
No. Tin fish uta yung khala mo molomo mo matsohong, not the.
Okay.
Why wanna biology?
Yeah, hey.
Important biology.
Yeah.
So the condomize is very important, and we have to mention that condomizing, there are male and female condoms, but I don't know why ladies are not latching onto the female condoms, because that gives you, you've got your life in your hands, and you can even put on the condom way before the event. I go what's about today, go. I kiss we were guy.
All white.
Go check Buddha. Go all white.
Yeah.
Check Buddha. I don't know.
No, it's still
Okay.
yeah.
We are go young. Why it's okay. What the kids how the moto? We're not very. Which is not something that should happen. But we are sad. It show me how you feel. We don't encourage it. I wouldn't encourage it. But mutu abe clever about themselves. That self-awareness. Be aware.
Yeah.
So what you gonna do when it comes to the female condom? You put the condom on usatsenya makeup go high. You put it on
Before you leave your house.
before you even leave your house. So whatever happens when now sharp. So I don't know why girls are not doing this. I really don't know.
Yeah.
Because asiyana motsosunyana o kasera witse hanya ki wena batho ba buzukana ba bone next wena o safe tla.
You already.
What ki?
Yeah.
Oh, why is it today? Ke bone mang e go social media ntse re clickana like
The what that means, yes.
so tla ba le teng da I vele eng you why what it's ba go
Yeah.
that vele first date is on.
Yeah, I like this idea, yeah.
Bereka dilo tsa how clever.
I like this idea.
Ready.
Yeah.
Very okay.
Okay.
Ready. Full 100%.
Yeah.
So that's the condomize. But then I want to just to save time, let's move on to other preventive measures. Like the key STIs. But let's get to HPV. How do you prevent this HPV infection? Number one, there's a vaccine. Yeah, will prevent the HPV.
Oh yeah.
This vaccine is supposed to be given to boys and girls, ideally before they start being sexually active. So we start from the age of 9 and we can go all the way to the age of 26 actually. So you would have heard about the vaccine. It's just that the information is not always easily accessible, or people don't understand what they are seeing. But the information is out there. Most people who have young children, young girls in primary, they would know that at the ages of 9, 10, 11.
Yeah.
They've been getting the vaccine. It's just that sometimes when how is getting a vaccine, you don't even know what this vaccine is. But most kids who are going to public schools, Baba Nyana, they've gotten this vaccine in the ages 9 to 13. They would have gotten the
So there's an age limit from.
There is a limit. Now you can take it all the way to 26, but the primary focus 9 to 15. But you can even do it after 15. I get the point where you must get them before they are sexually active.
Oh.
Before they become exposed to the HPV.
Doesn't it say that if they get it at an early age, we're just saying, you can go. You are vaccinated now.
Next, that's a big topic.
Yeah.
I think we will have to cover one another day, because there is always that tussle or information or so we are encouraging them to do this. There's been a lot of debate about should we be putting condoms in school. But but why would be worried to condom goes license to do this.
I see what
you see. It's a difficult one because they're already doing this, whether you give them condom or not.
True.
So
yeah.
So let me go back to HPV. So there's the vaccine. That's one prevention measure.
But I also think for them, when you are giving them at an early age, 9 to 12, right?
Yes.
Besides getting them before they start engaging in sexual activity, so woman they might also transmit those infections.
Oh yeah. They would want to sleep with the kids. Okay. No.
Thank you so much, Meg. It's a topic we wish we don't want to engage with, but it is a reality. So
Yeah.
indeed, we have to support the vaccination. And mara, as I was saying, bana ba leng ko public school, they've gotten this vaccine. And I want to reiterate, it can be given from the age of 9 all the way to 26 years.
Oh.
Now, let's talk about
What are the other ways? Yeah.
we'll talk about the other ways, but I want to just make just one statement about kids who are in private school. Kids who are in private schools haven't gotten the vaccine because the government has focused on the public schools first. So, if you're a parent and your girl is in private school, it's also stand up, like make sure your child gets the vaccine.
Gets it. Yeah.
Now, let's talk about the other measures. Now, here's the thing about this infection here, HPV. Is primarily responsible for the cervical cancer. You don't get HPV today, get exposed to it, ubeli infection, and then next year, sonally cancer. Doesn't work like that. You can get an infection today and only get cancer or develop a cancer 30 years later.
No.
Yes. And when you have the infection, there are no signs. Like there's nothing we can see. You don't get a discharge. You don't get even the cauliflower. Those types that cause cancer, when they infect the cervix, they just stay there silently. And they will stay for years. Now, in a lot of people, I must just qualify this. In a lot of people, after they've gotten the infection with this HPV, 80%, when I say a lot, 80% will clear it within 2 years. Like the immune system will wash it away.
If the immune system is strong enough.
Immune system is strong, it's not a problem. But then in some people, the 20%, over the years, this infection can cause sores, changes in the cervix. But these changes do not become cancer immediate. Iba siso, and then over time, this sore becomes cancerous.
Yes.
Yes. So it's important to understand that, because you see, this is why I'm so passionate about cervical cancer. In this period between the infection and there's some 30 odd years of developing cancer, if we are able to pick up siso before SIBA cancer, and we can do something about it. We can remove siso.
Or before it actually becomes.
Before it actually becomes cancer. We don't have that luxury with a lot of cancers. Now let's talk about how do you pick up siso. I'm going to talk about something women should know about by now. If you are a woman of childbearing age or sexually active, you need to know this information. The test that we have been doing all along is called the pap smear. The pap smear actually picks up the sores before they even become cancer. But if it's cancer, we will also be able to say, oh no, now it is now cancer. So we grade the sores. So this is a low-grade sore, this is a high-grade sore, now this is cancer.
Yeah.
When it's a low-grade sore, for many people, the immune system can still handle it.
Oh, yeah.
Yes, but once it becomes high-grade, we need to take the sore out. Now, let me talk about the pap smear. This gadget is what we use. The mouth of the womb is deep inside the vagina. So we go in with this gadget so that we can expose the mouth of the womb. So there are different sizes, and some are steel, some are plastic. Nowadays, we are using plastic. There's a lot of people who have not been coming for pap smear, but that steel thing. Please note, we are onto plastic most of the time now because it's easier. You just use it once, you throw it away. You don't have to clean it and all that admin.
Okay.
So here it is. Vagina, it goes in, and then we open up.
You open the vagina.
You see, when we do that, it opens up. Then we are able to expose the cervix here.
Oh, I see.
And then we just put it in place.
You screw the vagina.
And then we come in. It's a very soft brush.
Has it been in a vagina?
And then we push it in, and then we just take a bit of fluid and tissue material from there. But you can see we are not cutting anything, we are not slicing anything. We just do that. And
are we getting that on camera? Can you see it?
Yeah, we
Yeah.
bring it out,
Yes.
and then we have some water. We put this in the water, and off it goes to the lab. And we are going to get results that will tell us, is there a sore here? Is it a low-grade sore, a high-grade sore, or are we at cancer? So that's one test we are doing. Now, this pap smear, from the age of 30, the government has made provision. From the age of 30, you can access this. I'm going to talk a bit more about HIV, because with HIV, we start earlier. But
Yes.
generally, from the age of 30, every woman should start doing a pap smear, you see? And the pap smear can be done at the clinic. It can be done at your GP. It can be done at the gynae. And the fact that it's done by the nurse at the clinic doesn't make it any less proper.
Oh,
It's
yeah,
such a
yeah.
simple procedure.
But it can be done.
Yes, it can be done.
Yeah. So how often must it be done? Is it like
Okay. The government makes provision in under general for every woman to get it at least every 10 years. Remember that point, Yahori? You don't just go to cancer. It takes years. So you need to just catch at least 3-4 times in a woman's life. But let me clarify, when it comes to people who are HIV positive, it's a different story. HIV, the HPV virus will progress much faster. So for people who are HIV positive, we do it every 3 years, the pap smear. And as soon as we start with it, even if it's not 30 years, we don't start at 30. As soon as we diagnose HIV, we start. Even if we diagnose it at 18 years, then every 3 years we are going to be doing this.
Okay.
Right.
That's pap smear.
That is pap smear, named after the person who did this procedure. Now, some women are saying, people are not coming for pap smear.
Yeah.
Why? If you read the different researches, some people are saying it's uncomfortable, ibuhlungu. Some people are saying, no, rena re arenya go bonelwa ke batho. Ntse le re kgotla and whatnot.
True.
Yes, ma'am.
Are they only done to detect womb-related issues, or colorectal detector if you have infertility issues?
Thank you very much. That is a very good question. The pap smear only looks at the mouth of the womb. It will pick up if there are abnormal cells at the mouth of the womb. It will pick up if there is an infection at the mouth of the womb. If there is abnormal cells inside the womb, you're not going to pick it up here. So thank you for bringing that up. You know, some people will have problems with gynecological problems, and they will sit with them for years and say, but I've done a pap smear. My pap smear was normal. Forgetting that the female anatomy is not only confined to the cervix. You could have problems in the womb. You can have problems in the eggs, in the tubes that are carrying the eggs, and those problems are not going to be picked up by the pap smear. Thank you so much.
Oh, okay.
Right. Now, let me go back to the people who are saying, mara pap smear nna re ka se kgone." Well, we've got new gadgets. This gadget, for people who are saying they don't want to bonelwa, they don't want doctors and nurses poking them, this gadget, you can do this yourself. You don't need a doctor.
So not me, but they can
Yes.
use it, right?
Yes.
Yeah.
So they can just pick this up at a lab, or they can come to us if they want, and we will give them this gadget. Very easy. We show them how to do it. You just go into the ladies in a minute. You are done. You bring it back, and we send it to the lab. No doctor involved.
No doctor involved.
No.
Private.
People just come in. They don't even need to see me or see any other doctor. They just come into reception. They pick it up, and they go into the toilet, and it's done. And we send it to the lab.
Oh.
Then we'll talk to them once the results are back.
Yeah.
Can also go to the labs directly, and they can get this done. They just pick it up at the lab, they go to the toilet, they drop it in there. Another one, here's another one that we use. Now here we are picking up HPV. Ne? Remember the infection, we're not picking up abnormal cells. The HPV itself, or is it there?
HPV, yeah.
Yes. Then this one, tampon, normal tampon, nothing special. This is used like any other tampon, the Lilets, the Tampax, whatever you use, is used for periods. This tampon goes into the vagina
Yeah.
for 1.5 hours. So this one we usually give people to take home with it. so that you can do it while shopping. You don't have to be lying on the bed. You just put it in, you time it, you do whatever you are doing. Afterwards, as long as you are not on your period, afterwards, you put it in and then you bring it back to us and we send it to the lab. Then we will tell you. So now there's no excuse. Ya hore, now ba re nyake manetse go khotla go doctor ba re bonela and all that. You will do it yourself.
So there's women who are actually uncomfortable being checked by another woman.
Yes.
Oh, okay.
Yes.
All right. Interesting. Yeah.
Those are the gadgets that we have available. So there is another one, but I just didn't have stock of it. But please talk to your doctor.
Yeah.
Talk to the nearest lab and see if we can access these things. The point is just that we must pick up before it becomes cancer. You know, when someone dies of cervical cancer, it is just
you could have prevented it before. You had enough time to do so.
We have almost 30 years.
Yeah.
Yes, ma'am. You got the right material. Yeah.
It makes So she wants to know
with these
ones.
Test.
Yeah.
Yeah. Like, how do you know that you've got a good sample? It's not a poor quality compared to it being done by the doctor. That's a very good question. And people do ask. With these tests, they are DNA based. And I'll explain the importance of that. And if you use them as per instruction, if you put this in for 1.5 hours, we will get what we need. This one, if you use it as per instruction, we give you instruction of how many times you must swell it in. And remember, okay, I must just clarify this. For this test, we don't even need to get to the cervix itself. They just need to be inside the vagina. And we are able to get whatever little fluid is coming from the cervix. You don't need a lot. Why don't you need a lot? Because it's a DNA-based test. Your DNA is a powerful thing.
Yeah.
You know, I don't know if you watch Crime Channel.
You like crime?
I spend time there a lot, you know. But on the Crime Channel, it's just that there's a lot of science.
Oh, yes. See,
so if you look at the Crime Channel, you will see that someone can be convicted of a crime based on a single strand of hair. Oh, how do they do that? It's because of the technology that is used with DNA. You see, if you pick up, even if I do this, if they want to know they can just take a small sample here and they multiply it. There's a procedure they use to multiply DNA. It's called PCR. Yes. And they will be able to see, of all the 5 of us, whose DNA is this one? A single strand of hair. So you don't need a lot. You just need a little bit of fluid for you to be able to pick up the DNA. These tests are actually more sensitive than the pap smear. And because of their sensitivity, when we do this and it says negative, then, we don't have to do pap smears so frequently. We can extend the period of the pap smears. So these are very good, but people are not the same. I still get people who are saying, some people will say, hey, doc, yeah, I like this DNA technology, but you see, this one is for self, but they'll be like in kids because then they trust that, like, okay, I get your way, but get no charge.
Yeah.
But I mean, on your own, it could have worked. But then if someone is so concerned, then I will do it for them. Yeah. But these are very sensitive and they are not actually that costly. So when you compare the cost of the two, they are almost equal. This is slightly cheaper than going with the pap smear.
I want to know, have you ever touched like over 1,000 vaginas?
No, I'm not counting.
So you're not counting?
I'm not counting.
You have? And you also do circumcisions?
Yes. And I'm not counting. What? 1,000.
You've touched over 1,000.
I mean, circumcision. I've been doing circumcision since 2013. Yeah. And in a year, you can do, sometimes depending on the year, we've done about 1,000 circumcisions. In 1 year, you can.
In a year, you've in a year you've touched over 1,000 penises.
It's a body organ. It's like touching an ear.
It is not. It's not. It's not.
To me,
Yeah.
it is
Oh, because
my job.
you're used to it.
So I don't think about it
Yeah.
in that context. Some guys some will ask sometimes, now that you're on circumcision, like, dog,
Yeah.
man, izwanyaka size, like, and I'm, why you ask me? They say, no, but now we know you've seen a lot. You should know. Okay, just so.
Yeah.
But the answer is very simple. I always answer them. I never leave the question unanswered.
Yeah.
You can't know unless it's erect.
So,
So when it comes for circumcision, it's not erect. So you can't judge it. I'm like, no, I can't judge.
Yeah.
I mean, it has to be erect. And
Yeah.
it will never be erect here by me.
is that good? What?
Yeah. Yeah.
So you've touched more than 1,000 penises. Wow.
Like I've touched more than 1,000 ears, more than 1,000 mouths,
Yeah.
1,000 breasts, more than
Yeah.
1,000 abdomens. It's a body part.
You have. Yeah. Hey, that is amazing. You guys, are we good? Can we?
Okay.
Have you touched everything? Are we good? So you also touched breasts, like 1,000 breasts. Then.
Yes.
Yeah.
It's a body part.
Oh,
I touched all body parts.
Have you had women that when you're doing pap smear, they're like, like,
All the time. But that is not an of
Yeah.
pleasure. It says, it's uncomfortable. That's the
Yeah.
Yeah. No.
Like, don't stop. Like, pleasure, like, don't stop.
No. Because when people come,
It's uncomfortable.
yes.
Yeah.
Yes.
So we're going to close now. I want to hear from you. What's your parting shot? What would you want people to know?
Yeah.
And also people to remember you as, because I feel like we're still going to have sessions with you.
Yeah.
And the things that you're doing are amazing. And I also think Asmat Babanchi that know this information in this way. So they'll be asking more and then we'll have to bring you back again. So what would you like to say?
My parting shot.
Yeah.
Yeah. Well, we've talked about a lot of things, ne?
1,000 penises,
Sure.
vaginas.
Okay. But the key message, I want to focus on cervical cancer. That it is for lack of a better word, I feel like it's a useless death to die from cervical cancer when there is so much we can do and there's so much time within which we can do it. It's not something that you just wake up with, and we know where it starts. So my parting shot is let's focus on prevention. Get your kids vaccinated. That's the start. Talk to your children about sex and what are the cons of having sex and particularly having sex earlier. Let's talk about sex. Like if that is difficult for you, just wake up in the morning and just say sex 10 times. So that you just get used to talking about sex. We are being killed by this sex and we don't want to talk about it. But we all know that we are all having it. So we must just normalize talking about sex. So is the vaccination, let's talk about sex and let's deal with prevention. And also for women, please start doing your cervical cancer screening. If you are listening to this or watching this and you are over 30 and you've never done a pap smear, you're late. You need, as a matter of urgency. That's where you need to start. You can do it with the nurse, you can do it with the doctor, you can do it with the guy. Just get it done. And I don't want to hear anything about people saying, pap smear, ing. Here are the options. You need to pick one.
Sure.
You see, for me, when I deal with my patients, I tell them we need to do this pap smear or we need to do screening. If you are not comfortable with the pap smear, there's this, there's that. I want to become A1 because if I am lax on this one, then I'm going to sit with a lot of consultations that's cervical cancer.
True.
So we don't want that to happen. So please look after your health. For males, I know we were saying this is women's health, but since we touched a bit on males, we also need to make sure that you also do your prevention as well. All the things we talked about, the ABCs and all that, delaying sex, it applies to males as well. circumcise. Because when you circumcise, you reduce your chance of acquiring sexually transmitted infections. And by the way, males are also a target for the vaccination for HPV. Actually, the males also get what? And they also get penile and anal cancer. So the vaccination also applies to the males. So that is what I would say is, my overall summary of what we have discussed. But if you want to ask me, what do I want to be known for?
To remember as.
To be remembered as before that, yes, ma'am.
Before we get to that part, I wanted to ask, I don't mean to scare the audience, but what is the stats that caused by?
Okay. Yeah. Meg, you are asking a very good question. Meg is asking, what are the statistics? From the stats that are available, around 340,000 females get cervical cancer every year, and about 60% of them die from it.
Yo.
60% from something you could have prevented. You see what I'm saying?
Yeah, I'm not gonna lick anymore.
Guys, not this thing as cervical cancer, but in Kenya go hospital. At the beginning of the year, I had a couple of patients. I had someone diagnosed with cervical cancer beginning of 2022. Someone with cervical cancer who subsequently passed away. And then there was a lady with cancer of the womb who subsequently passed away. And then there was another lady with cancer of the vulva and vagina, the front part, also passed away. And now that you ask that question, that is what, if you can look at my timeline, Prince, and when I started talking about cervical cancer, it actually was last year around April, May.
Oh, yes.
It was after I was seeing those deaths, and I was just so sad because the cancer of the womb, you can't do much, and it doesn't really show itself very easily. But the cancer of the vulva I dealt with, the lesion were there, so necessarily more, but it took a while for, the person to ask for help. But what killed me the most was the cervical cancer. We could have done a pap smear, long before this cancer. And now, what I then subsequently heard from one of my colleagues, when we talk, it's not possible for anyone. I think I'm very boring. So
no, you're not boring.
I'm not boring to you guys because we have the same.
Yeah.
But general, I'm very boring because what want to get the study net?
Yeah.
I also want to take me. No, we like it. Yeah. So it's something that we should be talking more about it. And I then decided, when all this happened, it kind of like put me down a bit. I was very sad. Then I decided, no, I'm not gonna stay sad. I'm gonna talk about this thing
and do something.
I don't have the equipment, but I was never on TikTok. My first TikTok video was about cervical cancer.
Wow.
I was like, okay, now I need to find a medium where I can reach the people to say, guys, watch out, come on, this thing, So we have to. Because people, but you can't die like this. Over what?
Yeah.
Yeah.
All right. Yeah. Oh, I'm closing now. Oh, yeah. So, running. So, briefly, so what would you like to be remembered as? Because I know you have an amazing husband and he might be watching this. And yeah.
Oh, that's deep.
Yeah.
Very deep. I think what we didn't talk about, Prince, and I think I so that it contextualized this, what I would like to be remembered as or by. I don't have biological children.
Okay.
So for me, I know that this kind of footage is going to be my DNA footprint going forward. Even after I'm gone, I would like people to see Hore. Auntie Ausi was here.
Yeah.
I get maybe for Prince, they will look at your son, your daughter, and say, hey, Auntie Ausi. I don't have children, so this is my seed. This is what I'm planting.
Yeah.
But they must be able to say, there once lived a woman who just had so much to give. and wanted people who are ba be right, ba tsebe, ba fole. That's all that I want. But this should outlive me, and it will be my footprint. Or yeah, there she is. That's what she did.
And you have a beautiful heart, eh?
On most days.
So, but thank you for joining us today. And I think we're going to have to do another one. Yeah. Make do bookings and see, because you're a busy woman.
I know. I was disappointed today because I don't know where next am I gonna have a slot.
Yeah. No, we're still here. We're still here for you. So, guys, we're good. Can we wrap it up? Yeah. But thank you so much.
It's a pleasure. Thank you for having me.
Yeah.
When you have so much to say, you know that thing, Miles Monroe, when he talks about going to the grave empty. That's what I want.
Take it all out.
Like, it must come out. It must come out. I keep back email, but the next thing, but only shows. Here, when you got I get about that next. I get about
That's beautiful. That's beautiful. Yeah. So thank you so much. So thank you for watching. Please subscribe. Just make sure that you share and like. It's been informative. I believe that we're gonna have her again on our show. So from me to you, Eita Ola.